CI Health is brought to you by Aunt Martha's.
Varicose veins, it's a medical condition that's common in women, but it can also strike men at any age, and it's brought on not by one cause either.
Here with ways to treat varicose veins and leg swelling from Gibson Area Hospital, Dr. Dragu joins us. It's great to have you here with us.
Thanks for having me.
Absolutely. So varicose veins, I would assume people know when they have them, but how do they come about?
Yeah, absolutely. So varicose veins is a very common condition that unfortunately strikes both men and women. It's usually more common on childbearing females. However, they also happen in middle-aged men, but also younger and older alike. They can come as a result of multiple reasons. So the veins, as a lot of people understand them, it's obviously the pipes that bring basically blood from the extremities towards the heart, and they have these structures called the valves. And for whatever reason, the valves become incompetent. Then there is backflow and reflux into the venous system, and then unfortunately they become getting bulgy. And then from there, it's usually a vicious cycle that the more incompetent they become, the more bulky and with varicosity they become. The good news is that there is a way to treat them, and I'd be happy to talk about it.
Well, before we talk about the treatment, are they hereditary?
Usually not necessarily. So just because the mother or the father had them, it doesn't necessarily mean that you will have them. And also, just because you have them, usually doesn't mean that somebody else gave them to you. So technically they are not, but if somebody in the family had them, there is a genetic predisposition to having varicose veins.
Okay, we really gave some before and afters. I'm hoping those were before and after pictures, after treatment options. If we could pull those back up, I apologize. We were visiting about other things. What is the treatment procedure like?
Absolutely. So in the olden days, it used to be that you cut them open by surgical procedure.
Ooh,
and they will strip them
that
out.
sounds painful.
But more recently, we have new technologies, and at Gibson Area Hospital, we have the state-of-the-art technology and a very good imaging to actually do them in minimally invasive procedure. I'm a vascular interventional radiologist where we treat a wide variety of conditions, one of which is obviously varicose veins. The way we treat them is by minimally invasive procedure, by tiny little hole after we numb the area. Patient is actually awake, and usually the varicose veins are treated within an hour, and patient basically can walk right out within the same day, usually within an hour.
Any downtime following this?
Nope.
Wow.
The recovery is actually very, very good. They will have specific instructions of how to walk. I would, in fact, prefer them. They walk after the procedure for a certain amount of time, but there's no restrictions after the procedure.
Is it one and done, or do you have to have multiple procedures?
That's a good question. Most of the time, it's a one and done, but we can treat, most people actually have them both sides of the legs. We can do both legs at the same time or one leg at a time and see how the patient reacts and likes the procedure.
Can we see some of your pictures here? Because these are very interesting. And women that get these, I know they would have to feel self-conscious, not wanting to wear shorts or dresses or things like that. But if there's a treatment that's minimally invasive and can get you looking back to normal, why not?
No, that's a great comment. And in fact, I would emphasize that people get to treat the varicose veins for two reasons. One, for medical reasons, which is more important. These are associated usually with pain, achiness, itchiness, and swelling of the legs. However, now during the summertime, people are getting ready to go out and about, possibly at the beach, and wearing shorts. They become a little more self-conscious, not necessarily for medical reasons, but because they don't necessarily like the way that they look. Now, for example, I have here some pictures of some patients that this is how they present before.
Yeah, here, show it that way. Yeah, there you go.
Treatment. So this particular patient has what's called spider veins and reticular veins, and they are these venous structures. They are blue discoloration, and also they look purplish. Now, the way that we treat these, in fact, this is the mildest form of the varicose veins. You treat them with direct sclerotherapy, meaning you inject the medication and you immediately see them basically disappear. And this is how they usually look. Again, the results usually vary depending on how long and how severe the condition is. This is one form.
Okay, I have to stop you because unfortunately we're out of time. But if people want to learn more, maybe they have some questions and want to connect with you, you're there at Gibson Area Hospital.
Absolutely, yeah. At Gibson Area Hospital, that's where we are, and we'd be happy to see you. And this is also another way that they usually look. And after treatment, it looks after that. And what you don't want to have is obviously an ulcer. And unfortunately, I often see patients like this. And even at this condition, I think it's important to treat them.
It's amazing the advancements in,
I know.
in medicine
it
and
truly
technology.
Is.
So we appreciate you coming and sharing that.
Thank you.
For having me.
If you need a confidence boost this summer, they're the people to call and get those taken care of. We'll connect you at cialiving.tv. And we thank Aunt Martha's for sponsoring today's segment.